A bunion is another very common problem we see, most commonly affecting women. And one thing they notice is that it starts rubbing on the shoe. They have more and more problems finding shoes to fit comfortably. So a bunion was something that will get worse over time. What happens when you get a bunion, if you look at a model of a foot, the long bones here are these metatarsal bones. In a normal foot, they should be close together and parallel. The sides of the foot are even and the toes are straight. What happens when you get a bunion, the first metatarsal here starts to deviate and stick out towards the inside of the foot. At the same time, the shoe then will push the big toe over, and that's what causes a bunion. And this is a slowly progressive problem. Over time, it'll go farther and farther over. The foot gets wider and wider, and you have more problems finding shoes to fit comfortably. And when you reach that problem, something needs to be done to fix the bunion. And so when we correct the bunion, first evaluation is an X-ray. We look at an X-ray, and what that does is give us an indication of the severity of the bunion and tells us what type of procedure needs to be selected to correct the bunion. Generally, what's involved, the bone is sticking out. What we need to do is cut the bone a certain way to bring it back over and realign it. We'll also at the same time then straighten the big toe. Generally what we do now is use bone screws to hold the bone together, and so it heals into the corrected position. One of the big advantages of the bone screws today is that it will actually give compression to the bone and it will heal faster. Overall healing period is approximately 2 to 3 months, depending on their activity level. The good news about bunion surgery is it's no longer considered painful because of the new techniques and the use of the bone screw and medications. Patients generally don't have pain afterwards.